inserting a peripheral IV today. I would follow all GPSP guidelines. I've already done my 3 checks, and I followed my 11 rights while doing my 3 checks. I would not introduce myself. Hello, my name is Carmen. I'll be your nurse today. I'm going to insert an IV. I just need to verify your name and date of birth. I checked the wristband, and do you have any allergies that I need to be made note of before I start? No. And are there anything wrong with your veins that I need to do? And do you have any preferences? Okay, no. Alrighty, I'll go ahead and get my meds set up. Everything is closed, unopened, clean, and everything is within the expiration date.
She's already resting with us, so don't worry about it. And then the first thing you'll do is
Go ahead and make sure that this is halfway filled. I'm going to go ahead and go through, untangle my tubing.
so on plate. I need to make sure that I hold the tissue, making sure I don't put my ear away, the steel tube in the second. All the imaging. So this is before. I'm gonna try to be a little quicker because we don't want them to be that without trade. So the first thing I'm gonna do is
that one video was probably like this.
wash my hands carefully. And check my fingering on all my steel. Make sure that there's no hole or no that you can add.
Oh yeah, so long because I can
I know this is a
Now that it is all untangled, I'll go ahead and unclamp it. Going ahead and making sure that there's no bubbles through the tubing. After making sure, and I'd recap it. Maintaining asepsis. And I'd go ahead and clamp it back. And there's no bubbles within my line. Alright, I'd go ahead and get my supplies ready. I'd open up my needle, open up my J-loop, open up my IV starter kit, and I'd go ahead and tie my J-loop. Careful to maintain asepsis.
and then I can go ahead and fix this. My finger was messed up.
Already, I'd make sure that the clamp is open.
Now that fix it really quick.
I'd go ahead, open that, prime my J-loop, looks good. I'd go ahead and close the clamp, maintaining asepsis, and making sure I don't contaminate my clamp. And put it back in the package to maintain asepsis. And alrighty, I'd go ahead and palpate, make sure that I have a good vein. Looks like I have a good vein right here. I don't feel any scar tissue, no problems with the vein. I'd go ahead and perform hand hygiene. And on gloves. And I would put the tourniquet 3 to 4 inches above the site where I chose. And I check for the radial pulse. And it's there, and it's good. Alrighty, and I'd clean the site. With it being 30 seconds. Making sure that everything's clean. I'd make sure that it would be dry. I'd go ahead and get my IV. And I'd taut the skin, making sure I don't touch the site at all. I'd go ahead, find the vein. As soon as I see blood return, I'll go ahead and advance the catheter, holding the vein and holding the catheter, being careful not to touch anything. And I'd go ahead and hit the safety and put it into the safety bucket. Then I'd pop the tourniquet. And then I'd go ahead and secure it with a piece of tape. Being sure to hold that vein so blood doesn't come out. Holding on to the catheter. And I'd go ahead and attach my J-loop. Making sure to maintain asepsis. At this point, I can let go of the vein. Pop open the clamp. Go ahead and push a little bit. Pull back for blood return. And then push the full 10 milliliters of saline. Then go ahead and clamp it back. Go ahead and clamp it back. And pull it up a little bit more so the Tanzaderm doesn't get stuck on it. Holding the vein. And making sure that it is clamped. Alright. Go ahead and get the Tanzaderm. Place it onto the vein. Take it off. Take it off. And I'd go ahead and take off the IV med push. Have this up here. And go ahead and secure the tape down, holding that up. And then I would label it. And while I was pushing it, I would make sure that there was no signs of infiltration. No problems. And I'd go ahead and put my label on. I would put the time and date. I would put the size of the gauge. I would put where it's at, and I'd put my initials for it. All right. And now I'll go ahead and get my IV ready. And I will go ahead and scrub the hub. Not careful to not recontaminate it. And then just to be safe, I'm going to take off the cap and scrub it still with an alcohol pad. And I'd go ahead and connect the IV tube, making sure that this does not come undone. And if it does, resecure it. And I'd go ahead and unclamp J-loop and unclamp the IV, making sure that there's no signs of infiltration, everything's going okay. I would go ahead and set the infusion pump as ordered before I would unclamp it. And I would come back and make sure that my patient isn't experiencing any adverse effects to the medication or the IV. And then I report and record.